Apple is venturing into groundbreaking territory with its latest research and development efforts aimed at creating mind-controlled technology that could eventually allow users to control iPhones, iPads, and possibly other Apple devices with their thoughts. This initiative represents a major expansion of Apple's focus beyond traditional hardware and software into the emerging and complex field of brain-computer interfaces, BCIs. According to a recent Wall Street Journal report, the company is partnering with Synchron, a leading neural interface startup, to develop a system that enables thought-based device control. This technology is especially intended to assist people suffering from severe physical disabilities, such as ALS, amyotrophic lateral sclerosis, or spinal cord injuries, who currently have limited or no ability to interact with conventional input devices like keyboards or touchscreens. The core of this new system is Stentrode, a small brain implant developed by Synchron. Unlike other brain implants that require open brain surgery, the Stentrode is unique in that it is inserted through the bloodstream, typically via the jugular vein, and placed near the brain's motor cortex, the region responsible for voluntary movement. Once implanted, the device can detect electrical signals generated by neurons when a person thinks about performing a certain action. These brain signals are then decoded by software and transformed into commands that can be understood by Apple devices such as the iPhone, iPad, or Vision Pro headset. The end result is a rudimentary but functional, mind-controlled interface system that allows the user to perform simple tasks like selecting icons, navigating menus, and scrolling through content. Currently, the technology is still in the early stages of development and testing, with limited real-world deployment. One of the first people to trial the system is Mark Jackson, an individual living with ALS who is unable to stand or travel due to his condition. According to the report, Jackson has been learning how to use his iPhone and Vision Pro using the Stentrode implant. While the speed and accuracy of his interactions are not yet on par with traditional touch or mouse inputs, he is able to navigate screens and interact with the user interface using only his brain signals. This is made possible by leveraging Apple's existing switch control feature in iOS, which was originally designed to allow people with limited mobility to operate their devices using adaptive hardware switches. The integration of this feature with neural inputs showcases how Apple is adapting its current software infrastructure to accommodate this futuristic interface. The company is reportedly planning to go a step further by releasing a new software standard later this year that will enable third-party developers to create applications compatible with brain-controlled technology. This move would significantly expand the possibilities of the Stentrode system and encourage innovation across the developer community, leading to a broader ecosystem of apps that can be used hands-free by individuals with disabilities. Such software tools could allow for improved communication, entertainment, education, and productivity, especially for those who are otherwise unable to use modern digital devices. While this type of technology is not entirely new, Elon Musk's Neuralink has been one of the more visible players in the space. Apple's entry into the brain-computer interface field is particularly significant. Apple has a long history of turning specialized technologies into mainstream consumer experiences, often setting new industry standards. For example, in 2014, Apple integrated support for hearing aids directly into the iPhone settings, a move that dramatically improved accessibility and was later widely adopted. If Apple can replicate this model with BCIs, it could accelerate the adoption of neural interface technology, moving it from medical labs and research centers into homes and everyday use. However, significant regulatory and technological hurdles remain. Devices like the Stentrode still require further clinical trials and broader FDA approval before they can be made widely available. Additionally, while Neuralink has demonstrated more advanced and faster performance in some trials, Apple's focus appears to be on safety, scalability, and seamless integration with its ecosystem, an approach that aligns with its long-term strategy of making sophisticated technologies user-friendly and widely accessible. In summary, Apple's partnership with Synchron and its work on neural interfaces signals a major turning point in how people may one day interact with technology. By enabling direct communication between the brain and digital devices, Apple is laying the groundwork for a future where thoughts can replace touchscreens, voice commands, and physical controllers. Although this future is still years away from mainstream realization, Apple's foray into the brain-computer interface domain has the potential to revolutionize not only accessibility for the disabled, but also the broader user experience of personal computing, ushering in an era where thinking is doing.